everyone. Today we're meeting to talk about how to manage our mental health and our emotional health along with our kidney health. Being diagnosed with something like chronic kidney disease can come with many mental health challenges. So today we have Dr. Madhavi Salunkhe with us. She has studied counseling therapy. She's been training in behavioral therapies and she's been practicing since 2008. She's practiced both in the NGO sector and she has her private practice called Hope Unlimited. She herself is chronic kidney disease patient, stage 3, and she's a member of the Kidney Warriors Foundation. Hello, Dr. Marti. Would you like to tell us a little bit about yourself and CKD and mental health?
Yes. Hello, everyone. It is always an honor and it is my pleasure to be able to talk to every kidney warrior here. Being a kidney warrior myself, it is more of a very personal journey when it comes to mental health after being diagnosed with kidney disease. So, before that, as a counselor and a psychotherapist, uh, mental health and kidney disease, they are interlinked. First and foremost, let's understand that. A kidney disease, when diagnosed, disrupts the mental health, and when the mental health is disrupted, the stressors go up, cortisol goes up, blood pressure goes up, and it impacts the kidney functions. So, increasing the vulnerability of kidney disease to progress. So, the interlink between this kidney disease and mental health needs to be understood first and foremost to be able to manage the kidney disease. Okay, so what actually happens when somebody is with kidney disease diagnosed with at stage 1 or maybe even a later stage? Today I'm going to talk about the package. Kidney disease comes not just to the patient, it also comes to the family. Not in the physical form, but of course the psychological and the emotional aspect is also transferred. So we're going to talk about both the aspects today. Let us understand what happens to the patient. When the kidney disease is diagnosed, first and foremost, like any other disease, the first thing which comes to their mind or our mind is, how can it be me? So the denial phase lasts pretty long. And this denial phase does not allow us to accept that this is a permanent and a progressive disease. Now that it is diagnosed, half of the time we are thinking how it is going to be reversed. What can I do now so that my blood pressure goes down? What can I do now that the doctor in my next visit tells me, no, no, it is all vanished. So, this is the first challenge, first emotional and psychological challenge the family and the patient both face. In this situation, it is very important to understand that this is just the beginning. So, to start with, let me enumerate what exactly happens when a patient has kidney disease. First and foremost, let's understand the biological aspect of mental health. What happens biologically is the blood pressure is rising, so the toxins remain pretty much in the body, and that uremia or toxins remaining in the body causes our brain to function at a little lower uh, clarity, or let me say there's a stage, something called like a brain fog, where the clarity is not there. You can't approach to situations, decisions that clearly. Okay, the other biological aspect which happens here is the blood, which is I mean, there's a state of anemia, like the hemoglobin is down. Hemoglobin going down biologically means that the oxygen saturation in the blood is going down. And absolutely, when the oxygen is not there for the brain to function properly, there is a confusion state, less clarity. So, these are the biological aspects of mental health which needs to be diagnosed and taken care of through medical aspects. Okay, now moving to the psychological aspects, the first thing the family and the patient both do not have, like I initially said, it is more of denial कि ये मुझे कैसे हो गया, ये मेरा है ही नहीं, शायद नहीं है. All those kind of confused states are there. So there are acceptance issues. There is a lot of fear related to the disease. There's a lot of fear related not just to the disease but also to the progress of the disease. Like like every human being first starts thinking about when he's in a state of fear, the terminal part of it. So dialysis, death due to kidney disease, and all those things. So let me first clear, when we are dealing with these things, let's understand there is a huge span before we reach there. We have a lot of things in hand before we reach that stage. So that fear grips that patient, grips the family, and then they react in a very different way, where we see panic attacks, where we see that there's a lot of anxiety, there is no clarity, and the person tends to shut down. The routine shuts down, the communication within the family shuts down, happy moments shut down. They take it as uh, a curse in the family. Now, how to deal with this whole situation? Very less instances are seen where it is initially taken very positively. Okay, so, managing the illness, accepting the illness, fear of the, uh, what is going to come, there is no clarity of the progress, no understanding of the disease, the fear of suddenly changing lifestyle, suddenly too much of financial burden, which is mostly not spoken about, because this financial burden, the family, the patient tries to ignore and tries to find alternative medications, cheaper medications, and then in this situation they tend to harm the kidney a little more than it should actually progress. Okay, so these are the biological effects and these are the psychological effects which we see. Okay, what later on happens is, as the patient starts understanding what is happening, is then there's Google Baba, there is experiences, and then they tend to uh, over educate themselves. Okay, and that again is a problem. Initially I'm just stating what actually happens, and then these problems enhance because then the stressors increase. Okay, so what happens, suppose we take a general family scenario in a CKD home. The diagnosis happens, the patient himself starts feeling victimized, and the caregiver who is taking care of it is overburdened, and he or she starts feeling victimized in their own sense. For example, the mother has to um, take extra care for the food and extra care for hygiene, and father has to probably earn more. So the whole family is being victimized in their own minds, in their own ways, but the whole family structure now becomes affected by it. Okay, so exactly the reason why we should speak about it more and look after ourselves a little more, because then we can change the scenario. The main aim of discussing mental health today is that we should understand how to deal with the scenario. Okay, so first and foremost, let us understand how we start coping with it. Okay, when medically diagnosed, the patient and the caregiver need to understand that when a person is medically diagnosed, it is time to first understand the factors within control and factors beyond control. Okay, the most important part here is when we decide, okay, fine, this has happened. Okay, everybody starts fighting the disease. My motto with myself also, as I said, as a personal journey, when I was diagnosed, my doctor told me, and being a medico myself, I asked the doctor, is there a chances of reversal? क्या मैं कुछ करूं जिसकी वजह से ये reverse हो जाएगा? The doctor sat in front of me and then he asked me कि he started questioning my degree of MBBS. But of course, yes, this was to happen. After that, I sat in the cafeteria for 2 hours because I did not know how to deal with it. I never thought that I am going to be diagnosed with CKD. I don't know what I was thinking. I had my nephrectomy in 2007, and then it was like, okay, एक kidney पे सब जी सकते हैं, and I was in that bubble. And when diagnosed, I was having a lot of trouble to accept. I thought it was unreal. Then I decided not to tell my family initially. But again, as I told you, I was overthinking and thinking of the future. I immediately went and met the social worker of the hospital asking for how to go about kidney donation, how to go about the transplant. After which he told me that you have to go to dialysis first and then you speak about transplant. So, even being a doctor, I myself was so hassled that it was very difficult. Okay. When my family came to know, especially my parents and my daughters, they were like, okay, let's do the transplant tomorrow. Let us finish it off. It does not happen. Okay, so that is exactly why we first need to understand what are the factors within my control and beyond my control. Okay, before that, of course, accepting that this disease is now a progressive disease, but the factor within my control is the speed of the progress. कितनी जल्दी वो stages आगे बढ़ेंगे is going to be somewhat in my hands. At least 50 to 70% I can slow down the progress of the disease. Okay, factor beyond my control is probably how the kidney decides to function. It has a lot of other things which are into account, the biological aspects. So first and foremost, coping may accepting the disease that yes, this has happened, educating ourselves with proper medium, speaking to the nephrologist, speaking to renal social workers, talking to other patients about how the disease has affected them. This helps. So, educating ourselves in right mediums is going to help. Factor within our control now comes to taking our prescribed medications very, very meticulously. Because these medications, we need to understand that now our kidneys are, our filtration is not working as good as it is. So if we shift our medications, the timings, the doses as per our will, because most of the times we see patients बहुत सारी दवाइयाँ हैं, इसमें से कुछ नहीं खाए तो चलता है क्या? So those kind of questions come. But it is very important that if we need to keep our mental health in place, we should know that the medicines are taken properly. The functions of the medicines to take care of the kidney keeps happening. The other factor is movement. The more we move, the more the blood flow, the more the kidney functioning is better. The third and very important part is the diet part. So the factor within control are taken care of, and factor beyond control are not made stressors. This is a very important point. Factor beyond control should not be made the stressors. For example, suppose we right now do not have an understanding key, uh, like of course yes, self medication is something which we try to take in our hands. I think that is a factor beyond our control. We are not educated for it. We should not uh, put our hands into self medication. Okay, coming here, there is a lot of commotion which happens with alternative medications, I mean alternative therapies. Having a complete education about it is very important. There's a lot of literature available, there's lot is available, but please do not go beyond your nephrologist's opinions. If you have your mental health in peace, we need to trust our nephrologist. So mental health is directly proportional to your trust in your nephrologist. It is absolutely clear in that. Okay, the next part we come to when we decide about coping with the disease. Okay, it is very important to understand that like the scene which I just said, the mental health and the CKD are interlinked in a spin, like anda pehle ki murgi pehle. It is the same way. Is CKD destroying the mental health, or is mental health destroying your CKD? It's going to be a spiral. So it's very important to understand the factors which are troubling you. If possible, I suggest this to the family. I suggest this to the patient. Everybody, please try and make a note of how you feel. You know, we speak of love languages. We speak of, oh, somebody has a love language of holding hands, somebody has a love language of sending letters. So there is something called distress language, there is something called sadness language. So there's a emotional language, okay, which I think will help us cope with this situation a little more better. So suppose a patient is getting very angry, okay, and we don't understand why is he so distressed, not deciding to take medication, and the family does not understand and shouts back. Or it could be the reverse, the caregiver is very anxious and very jittery, and in that situation feeling victimized is making her or him very I would say erupting with anger or not paying attention. Let us understand that this language, understanding this language of the family with towards each other is going to have a healthy atmosphere in the house. For a mental health situation to be in accordance, in peace, in the whole family, it is important to understand the language we speak to each other when a disease is there. Of course, it keeps playing back of the mind, but it's important to understand why, what makes you angry, why are you so frustrated, what is it that you are not able to tell me, okay. This openness of communication gets the patient and the caregiver both to understand each other better, because it is not just the patient who is, the disease is in his body, but the caregiver who is managing rest of the things, it is being managed at a emotional level, physical level, both, okay. So this distress language, this emotional language is important to be communicated in the family openly, okay. I would always suggest for a CKD patient in general to understand the disease properly, okay. So for me personally, I decided that I'm not fighting her disease, okay. I started making friends with the disease, okay. So what happens with this attitude is that if it is a friend, I can understand my friend a little better. If I say I have to fight, most of the time I'll be cursing my disease. Why are you within me? Why are you troubling me? Why are you doing this to me? Why are you doing that to me? So I decided to befriend my disease and then trying to understand, talking to my kidney, okay, so this is what is happening to you. I'm sorry, I've eaten junk today. So this kind of communication has helped me personally. Okay. So it's important to understand the progress and the factors which can stop the progress. Okay. So that means a very calm mind is needed to understand what is happening within your body. Okay. What happens to the food that we take does not mean that you need to be educated in medicine or science for that. Every morsel you take, the amount of water we take, the amount of movement we do, let us let the kidney patient sit down with himself, spend time with himself, and understand the progress better. That will give a good uh, understanding, and the stressors will reduce. So the mental health is pretty much at peace. Other very important thing which I would always want to suggest is, please talk finances. Okay, it is important to talk finances and be active even in the zone of earning as much as you can till wherever you can. Okay, let not the disease stop you from being financially independent. Okay, that's very important. The other part is, uh, if you have want a good mental health or a good mindset, I would say, to be able to deal with the disease, it's very important that you have a good support system. It is for the caregivers also and the patients also. So Find a community, find a support system which makes you happy, which makes you feel good, which makes you feel de-stressed. Everybody. So for example, there is a patient on dialysis. Mostly after the dialysis, patient comes back tired and then the food and everything is done. And if the caregiver decides to go for a movie, the first thing is, मैं यहाँ पड़ा हूँ or you're going for a movie. Okay? It is very important to understand that everybody should find de-stressing moment and that should be given to the other person. The same happens with the person that somebody who is looking after the financial part is running around quite a bit, doing double shifts and stuff, and the patient with CKD is probably putting his feet up and watching Netflix. Okay, it is not about what you are doing and what I am doing. I'm telling this about within the family. It is important that helping the other person de-stress will keep the mental health of that person himself and the whole family in a very conducive situation where everybody has a good sleep at night. Okay, this is very important. So coping skill includes understand acceptance of the disease, understanding and educating yourself with proper mediums. The third part is understanding the factors within control and working on them. Understanding the factors जो आपके हाथ में नहीं है वहां पे सिर मत मारिए. Okay, finding good support system for de-stressing. अपने लिए वक्त निकालना बहुत जरूरी है. Okay, the disease is in the kidney. Don't allow it to spread its secondaries in your brain. My specific words are here. When a disease is in the kidney, yes, of course, the body is also a part of it. But like cancer, don't let it spread into your brain. So overthinking about the disease is going to cause a problem. Okay, it is not going to help the kidney. It is going to worsen it more. So let it be in the kidney. Be friends with your kidneys and understand them. Last thing which absolutely worked for me, I did a course on sound healing last year, and we were supposed to write 25 gratitudes every single day. Okay, so it was a mechanical thing about writing gratitudes, and it was 5:36 in the morning when I was writing that, and I suddenly had to go to the washroom for to pee. And I came back and I wrote, thank God I could pee. So, why I'm sharing this with you that for a kidney patient, being grateful for that is so important. Okay, so let us, for our mental health, understand what we already have, what we can preserve, and what we are going to let go, and be grateful for what we have. So there's a lot of it which will help our mental health be at peace when we say that I'm grateful that I have a family who is supporting. I am grateful that when I go for dialysis or when my kidney disease is progressing, there's somebody who's taking care of my diet. There's somebody who is looking after the finances. I am grateful that I have a doctor who I can communicate to. Okay, so gratitude is the biggest, I would say, remedy for a good mental health in CKD. Okay, and it's very important that when we are talking about the coping capacities, we need to have a complete open communication. As I already said, we need to understand the pain language, the distress language, the sadness language. Instead of labeling the patient or labeling the caregiver, it's important to understand what is going through. Okay, it's very easy to play victim. It is very easy to sulk in the disease, but that is going to worsen the disease. So ऐसा होगा कि आपकी mental health अगर आप संभालने की कोशिश नहीं करेंगे तो उसका impact, you will be a contributor to the progress of the disease. I don't think any patient wants to be that. So it's very important. The other part which I want to stress is, suppose any symptom. of anxiety. Anxiety, as in you're worried about something for more than 2 weeks and you try something and it drops down again. The coping mechanism is not working. Or if you have a panic attack and you're not able to manage it with simple techniques like breathing, diverting, or drinking a lot of water, if it is not helping, or if you feel that there is a uh, uh, lack of clarity and there's a lot of confusion, please see your nephrologist, please see a psychiatrist, please take help. Because trying to be stronger than we are, कि I don't want to look weak, I don't want to feel weak. This applies to the caregivers also, that don't appear to be very strong when internally you're all broken. If you need help, I think seeking help is the best thing we can do for our kidneys, that we seek help on time, whether it is a psychologist, a psychiatrist, a nephrologist, a renal social worker, whoever, but speak out, communicate. Okay. And last but not the least, before we take questions, is water, oxygen, sleep are the three very important things which help mind, body, kidney to calm down, to settle down. And these three things don't cost money. Okay. So these are the things which are in our hand, which we can manage well to be able to manage our mental health at a very, I would say, a clear level where our kidneys are not affected because of our mental disturbances. Yeah. So I'm open to any questions, because anything which is in anybody's mind, do let me
Uh,
know.
yeah, thank you, Dr. Madhuri. I think this conversation was very important. Something you said that will stay with me for a long time is when you said that, don't consider it a disease. Treat your kidneys as your friend. I love the part where you said that you thanked your kidney for, the job that it is doing in the present. Something you spoke about pertaining to, I think, and now we'll go on to the questions. So, one question comes from Ved Prakash. What he's asked is a very relevant question with respect to quality of life. Something that kidney patients often fear is the quality of life. That he is asking with specific to love life, that who will love me, who will fall in love with me. He also notices that this is something that happens in foreign kidney groups very often, where people do find each other. But in India, that is not there often. What would you say, how to navigate this kind of fear that, I have career dreams, what if I can't achieve them? Or what if I want to have a marriage, I want to have kids, that might not happen. So, what kind of attitude or mindset can help us navigating these challenges?
Okay. So, first and foremost, let's understand that the situation never traumatizes us, the attitude towards it is more traumatic. Okay. Now, for example, as far as this situation is concerned, the dreams you need to achieve, whether it is love life, whether it is having kids, or getting a dream job, maybe. So, first and foremost, let's understand that it is not a all or none situation. Okay. So when there's a possibility, so I won't say certainty, but I won't say it is absolutely a certainty that ऐसा होगा ही नहीं. Okay, there is a possibility. Okay, so what happens with the dream job? Hmm? So, but obviously, you might have to step differently, step aside. I won't say step down. Okay, I will say step aside. For my personal example, I am trained in medicine. Okay, I was doing my medical practice when my kidney disease was diagnosed. Okay, but since I was always interested in psychology, my psychology study was going on with absolutely no aim of stepping into this field. Hmm? My doctors told me that if I was doing general practice, so if I get infected, which I would easily get infected, and I would not be able to take medicines and antibiotics as other people usually can and get rid of the disease, I would have to decide not to do medical practice actively. Okay, I can do administration, I can do this, I can do that. So when I shut my clinic off, and when I uh, though not planned, shifted to psychology, I am thinking that it is a boon. So I will always say that it may not be a step down, but it was a stepping aside. Okay. For last few years, I was doing two jobs, and that too pretty much full time. Okay. Then slowly I get tired. I decided to move to freelancing. Then I decided to move to being a visiting faculty. So changes keep happening, but you're doing a service to the body and the kidney, I feel. Okay. So the dreams keep changing with the age, we say. Okay, for a person who wants to be a millionaire or billionaire, say by 40, wants to retire also. Okay. So similarly, when you have a disease, I would say you might have to step aside, so you can create your world around what are the possibilities. Okay, similarly with your love life, somebody who can accept you the way you are is the person who is going to be with you as it progresses. Okay, so as far as the other things are concerned, having children, whatever the medical facilities now are, the possibilities are there. Also, the kidney disease is not ending into dialysis and death. People are going for transplant and having a good life. Okay, so it is not a all or none situation. There is not a certainty कि ऐसा होगा ही नहीं. It is just that you have to shift your attitude to a different set of choices. That's about it. So it's the way you look at it now.
Mm. I really like what you said, that we have to shift the different choices, right? And consider it a possibility, not a certainty that this will not happen. Correct.
Absolutely.
Another
Absolutely.
question comes from Bhargavi, who mentioned that within the realm of this kidney journey, how do we manage any failures that come along the way? Like you said, that there is that idea of self-victimizing, kind of blaming everything on, oh, because I have the kidney problem, this has happened. How do we move past that? Yeah.
Okay. So, first and foremost, we need to understand, are we having this failure because there is a kidney disease? So, for example, you are not getting a promotion because you don't have a kidney disease, because that involves a lot of travel. So, let's understand why the promotion is not coming. Okay. So, that is not a failure, that is again a service to your kidney, maybe. Hmm? But if there is something which you feel that even the people around us are victimizing us because of the kidney disease, maybe it's time to shift the place of work or the people. And plus, as I also said, that we need to communicate openly about it. I got a huge support when I joined Kidney Warriors Foundation from Vasu ma'am, from everybody, because this is where the whole acceptance of the disease, the whole understanding, the way everybody is struggling to try and get insurance. So we have a community of ours where we are accepted. So I would say failure again, ask yourself, was it because of the kidney disease or the way you looked at it? And telling yourself, for example, as I told you, that if you have to step down as far as the workload is concerned, it may not be a failure, it may be the service you're doing to your kidney by not stressing it too much. Okay, for example, a project is given to you and you are not able to complete because you had dialysis, or you probably were not feeling well, or your anemia was not allowing you to concentrate much. So the acceptance of that part will help, I feel, because this is an entity which is now with us. We cannot deny it, right? Yeah.
Correct. Ved has asked another question, and I think you mentioned it quite correctly earlier on, that there is that tendency to progress to the worst possible outcome, especially I think for people on dialysis. So I think what Ved is trying to ask is that what kind of steps or what kind of speed breakers that we can put in between to stop this fast progression, right? Because sometimes I think we progress it more in our mind than it's actually progressing in real.
Yes, you said it absolutely right. You have already answered it. The speed in the mind and the actual speed, which is actually happening, are two different zones. I'm sure nobody wants the kidney to deteriorate the way it is going in the mind. Okay, so here, very, very important point I would like to tell you, whether it is our thoughts, whether they are our actions, whether, I mean, behavior, or whether they are emotions. There is nothing called positive and negative. Okay, a positive from your side could be a negative from my side, but there is a very nice term called helpful and unhelpful. Okay, if the way I'm thinking about the progress and getting scared of how I will be when I went on dialysis, going alone for the dialysis, and my bank balances are coming down. Is this helping me sleep properly or sit here quietly? No. So if it is an unhelpful thought, an unhelpful behavior, or an unhelpful emotion, let me not nurture it. Okay, nurturing is like feeding a horse who is not going to anywhere run in the race. Okay, so we can limit that. Similarly, suppose the same thought. Okay, my bank balance is going down. So when I'm in dialysis, that stage, maybe this is going to happen. Oh, let me procure the balances now. Let me see how I can multiply my money or start doing some kind of a business. So this is the same thought in an unhelpful manner can be this way, and helpful manner is the other way, which I said. So as I said again, don't be the creator of the problem. We have a CKD, it is going to progress. Let it not progress in the brain, because that then you'll be the creator of the same progress. People call it manifestations now, right? So the same thing, let's not manifest, it is going to it, let's understand it's going to, but don't lose out on moments which you have in hand. This gratitude works for that.
I think I have a question. So what you said, right? The moments that we have in our hand, which is more like living in the present. What would you say? In the moment, what can I do if I'm spiraling into anxiety to remind myself to stay with the present? What can I tell myself, or what can I do in the moment?
So very importantly, journaling helps. Okay, when you know that these are the thoughts which are there and you understand that these are spiraling, you can always write down what you feel. Okay, that is very personal. See if it is helpful or unhelpful. If it is unhelpful, immediately cut it down. Okay, I have this red pen with me. If I have those thoughts in journaling, I cut them down. Okay, this is one factor. The other thing is affirmations. So when you affirm yourself in the morning that I am going to live my day the most purposeful and healthy way I can. Okay, so this thing helps. Again, gratitude journal at night, just even when you're putting your laying your back on the bed, before you actually, we have a habit of the phone with us, so keeping that aside, and just think about 5 things you're grateful for today. The spiral stops when you say, oh my God, thank God I was on my feet today. I did these few things I'm grateful for, not what went wrong. These are the things I'm grateful. So the spiral stops. Okay. Just for an example, I'm sounding as if it is a cakewalk. I know it is not. Of course, it is not. I had my daughters were very tiny when I was diagnosed. And I'm a very filmy person. I love to watch films, and I had written down notes for them. Like when I die, they would read. Okay, that was not enough of an emotional drama. I had recorded it, that this is how it happens and all. I was supposed to travel to Ahmedabad to meet a nephrologist, and I said I'm not traveling because my younger daughter was 3 years old. I said, no, no, if I die on the way, then okay, that was in 2009, and now it's been so many years. So that doctor, I mean, this was a life changing thing for me. The spiral was going on in my head. He told me, do you have a guarantee that you're going to die with kidney disease? No. You are just crossing the road and there could be an accident and you could die. So the whole certainty possibility thing came into me. So there's no certainty that it's going to happen. Stop playing it in your head, thinking that it is a certainty.
Correct.
Okay. So this helps. So it is not a cakewalk. It is a matter of practice and wanting to make the most of the day. That's about it.
Yeah.
And we have good days, we have bad days, we have awful days.
Hmm.
Everything is there. Everything is there. But accepting that it's a part of our lives. It's not like every next day morning is going to be a new day.
Yeah. Yeah. Makes sense. I have a question from Neha. I'm just going to read it out. So CKD patients, and for that matter, I think dialysis and transplant patients often struggle with sound sleep. Does lack of sleep affect mental health? So she's looking forward to a solution. What can she do to improve her sleep?
Okay. Yes, lack of sleep uh, increases the cortisol levels in the blood. Cortisol is the stress hormone. If you don't have sound sleep, the cortisol level increases and the mind is active throughout the night, and that when you are active the body gets a signal that um, it's a situation of distress, and then the whole blood flow is increased and the blood pressure is increased. So your kidneys and liver which detoxifies during that time is functional like in the day, so it is overworking. Okay, so it's doing overtime. So but obviously it affects the progress of CKD. I personally also struggle with sleep. Okay, I'm trying my best to change the timings and things like that, but what the solution which I have made for myself is that I can't sleep very early like a good girl at 10:30, 11, but I tend to make it a good sleep, good sleep hours. Okay, so what you can do to improve your sleep? One is be well hydrated. Be stomach should be towards the emptying time. So having an early meal probably will help you better sleep, because when you eat late, the digestion process is so active that sometimes it is um acidic, when you feel acidic while sleeping. So those things are there. So if you can have an early meal. The third very important thing is blue light avoidance. So screen time has a blue light which keeps your brain and in the active mode. Okay, so neurotransmitters are functional during that time. So it's important that you see that you don't have screen time uh, at least half an hour to 1 hour before you sleep, whether it is TV, mobile, anything. The fourth important thing is the light in your bedroom. Okay, so if it is lit, try reducing the lights, being dark, to be able to sleep peacefully. If you need a zero bulb, see to it that it's covered. Okay, no direct light. That is one important thing. Check medically if you need to go to loo in the night more often, or what is exactly causing you sleep disruption. If there is some anxiety or overthinking, deal with it first before you decide to sleep at night. So the root cause and the organizing methods are this, which can help you sleep better.
Our next question comes from Jacob Jonathan. So I think this again pertains to self medications and just being curious about the medicines we're taking. So what he asks is that for those on immunosuppression, which is a medicine commonly taken by post-transplant patients, for those who might not know, short temperamentness and sadness, Are they side effects of anti-rejection medicines, or is it just a false belief that they impact them?
So honestly, if you ask me, I don't think there's a direct impact of the medication on your, immunosuppressants or anti-rejection medications or on your mood directly. It could be a lot to do with your mindset also. So if your mindset is not right, correcting that first is very important. If you need help, you should take help. But I don't think immunosuppressant drugs will have little mood alterations, could be a different story. But if it is sustaining, then you need to talk to your nephrologist about what is to be done. But I don't really know of direct impact of that.
So now I think there's a very interesting question that is asked by Neha. I will go ahead and paraphrase it. So what she essentially says that there is an expectation for kidney patients to have a certain attitude with families and relatives, which essentially is a positive attitude, where they're expected patients to always be positive, always be strong, always be smiling while they go through their treatments, no matter how sick or how negative they might be feeling, there's not always space to express that with family. So she's asking, how can we manage that? How can we navigate this balance between gratitude, like you said, and days where you're actually feeling beaten down and respecting those?
So, Neha, one very important thing. Uh, there is no there is no need to invalidate your emotions. Okay, there is no need to always find validation outside. The way you're feeling is the way you're feeling. You're beaten up, emotions are there, you're feeling low, you're feeling anxious, you're feeling burnt out, you're feeling distress. Please don't deny them. Don't put a wrong face ever. Okay, but again, it is important that any emotion you have, the expression makes the whole drama. Okay, suppose I'm very angry, unless and until I decide to throw something, break something, or say something nasty, that anger is not seen. But I may be angry and I can stay angry if I feel like staying angry. Okay, so validating what you feel is very important. Don't ever deny what you feel. Okay. The other part is when you communicate this to anybody in the family, of course, the family needs to be understanding for that. If they are not, please find a support system, a friend, or a support group where you can say out what you really feel. Okay. Gratitude, being grateful to your family, does not mean hide what you feel. Okay, if the communication is great, nothing like it. If it is not, find a support system. Okay, same thing is goes to the caregivers also. Okay, what happens with the donors here sometimes is they have done a very noble cause. Okay, after which they've done their job, and somebody who has got a new kidney and is on immunosuppressants is the whole focus of the family, of relatives. It's important for, if the caregiver feels distressed, please say it out. Same with Neha, please don't invalidate your emotions. The way you feel is the way you feel, because otherwise you keep it inside, and it is suppressed and suppressed and suppressed, and this is how volcanoes happen. Okay, so don't make your volcano, because your volcano is directly affecting your kidney. And even the transplanted kidney, even the kidney who is on dialysis, which is on dialysis, even the kidney who is trying to struggle to breathe. So everything is there. So yes, you should be strong. You should not cry. You should not. Okay, you feel like crying, go to the loo and cry and call up a friend who understands. If the family is not understanding a distress language, but don't invalidate your emotions. Never.
Yeah, yeah. I think
Okay.
we've covered the questions that have come in. I'm just going to just go over, just see if I'm not missed out on anything else. Um, Meanwhile, Akshat, if you have any questions that you'd like to ask while I go over the chats and the questions, please go ahead and ask. I'm just going to read through.
Absolutely. Thank you, thank you, Varnaya. And Dr. Madhavi, that was a wonderful session. I can only say I wish I had got this about a year earlier when I did get diagnosed with all of this. It's been quite a ride, and I think one of the most interesting things was learning that how much of your mental health is affected when you actually have CKD, as opposed to what I was told is that, yeah, I'm post transplant, when you do get your transplant, you are going to face a lot of mental health issues on account of your medicines. So when you said the words brain fog, it was literally like, oh yes, I did feel that, I just did not know how to say it. But anyway, my question would be, and this is from a post transplant perspective, is that uh, a lot of these things, a lot of these changes that I've undergone over the last year, nobody obviously asks for it. But now I'm at a stage where, I don't want to use the word normalcy, but post transplant, after the first few months are done, I'm about to be 6 months through, is when you start of sort of try and bring back the aspects of your life pre transplant or pre CKD, wherein you're like, okay, cool, I want like to get back into physical activity, get back into meeting friends, get back into work as well. One of the aspects that I struggle with is I have spent the last few months being hyper careful about my health, as I've been asked to. How do you sort of mix that, manage that with all of the risks that come in from bringing all these normal aspects of life back? Just merely stepping out could be an issue of infection, or working, going back to the office is definitely an issue in that sense. So how does that, how do you deal with that, both from obviously as a doctor's perspective, but also from a mental health perspective, because it can get really nerve wracking, anxiety inducing. Thank you.
Okay. So the first point is I would like to rephrase that post transplant going back to pre CKD. No, that's not happening. Reality check. This is a new phased post 6 months of your transplant. Okay. So now, hence on, with the new kidney, there are new parameters of well being. Okay. So the new parameters of well being, sports wise, stamina wise, infection prevention wise, everything is a new parameter. Okay. So a normal pre-CKD person will not go and check hemoglobin thrice a month, will not go and check creat. Okay. We have to set our parameters post transplant. Okay. So considering the normalcy of a 6 month, okay, a 6 month post transplant patient. Okay. So let's understand those parameters. Medically, you be in touch with the nephrologist, be regular with the checkups, medications, everything. Okay. Be clear with your symptoms, everything. There are two fear factors, I won't say dushman of mental health. One is befikri and one is overconfidence. Okay. These two things, if we avoid, mental health stays well. Post transplant, the befikri, oh, now it is done. Because the whole trauma of CKD, the phases, the dialysis, the transplant immunosuppressant wala phase, everything is gone. Na? So there is a quick shift to, oh, it's all done. Okay, that should not happen, one. And secondly, later years, we count the years. So many years post transplant, so many years post donation. Even this again goes to the donors also. They also need to be checking their parameters like you will be. As far as the physical well-being is there, or physical stamina is there, or going back to sports, going back to work, be a little cautious about the infections. Okay. So because you have a sturdy boat, you don't go and check it in store. As simple as that, I believe. Okay. So have a very
Thank you, doctor.
steady movement in life. I think it works. I hope I've answered your question rightly.
Yes, yes. I mean, there's no going back to a normal per se, but and for me, everything was so quick that when I
Yeah.
think of it, it's like not 6 months. It's been a year. It's like that. Literally, you get diagnosed and then you go in straight. So thank
Okay.
you.
Yeah.
Hmm.
Um, do we have time for one last question, or do we? Rishabh has just asked one question. Um, what are the kind of conversations we can open up with our healthcare workers with respect to our mental health? So, if I need to communicate to my nephrologist, I'm struggling with some aspect of my mental health. How can we open up the conversation?
Basically, with the nephrologist and with the social worker, or with somebody who, a nurse, maybe a nursing staff or somewhere, it's important to tell what you feel. This is how I'm feeling right now. Okay. Also be prepared for they saying कि कुछ नहीं होता है, then that is not the right person. Okay. So then you take professional help also. So it's very it will be very nice if we have um, medical psychologist per se, or we have those kind of psychologists in palliative care. I always feel that kidney disease should be included in palliative care, because there's a lot of psychological support which is needed when somebody is diagnosed with it. So I think it's important to seek a professional help if you feel so. Otherwise, it's important to learn to say how you feel and tell that I don't probably want your suggestions, I just want you to hear me out if you want that. Within the family, you can start this way. This is how I feel. This is, I don't want anything from you right now, but it's just that I want to just open up and I say that I'm feeling distressed, I'm feeling sad, I'm feeling, I don't know how to deal with it, I'm anxious. So it's okay. It's okay to feel what you feel. But if professional help is needed, I think people should be open to professional help. If the nephrologist and the caregivers can approach, it will be great.
So, but like from what I'm understanding, it's a quite bit of self advocacy of your own feelings, and that comes from noticing your feelings and being okay with them existing. Yeah.
Absolutely.
Okay.
Absolutely.
I think we've gone through our bank of questions. Thank you, Dr. Madhvi, for answering so patiently all the questions that we've had, and also sharing your own journey with CKD and how you've been able to manage it. I think listening to this, many people will find it helpful. There are practical tips. There's a positive mindset that comes about. So thank you for this conversation. Yeah.
Thank you so much. And yes, I would last but not the least would want to share that I am a CKD patient and I go through all this also. It is not because I'm a psychologist so I can manage myself really well. There is always up and down, but there's a trust that it can be better. So just love yourself enough.